45 years ago, the Philippine Heart Center was built with a promise to provide the best in quality heart care for the Filipinos. Through the years, it offered medical and surgical services to people from all walks of life, as well as training and research opportunities to healthcare providers. The Institute continues to serve patients who suffer from various cardiovascular diseases, performing both surgical and non-invasive diagnostic and therapeutic procedures. The Department of Adult Cardiology is a pillar of the center's medical services. In 1975 to 1981, the division was devoted to training young physicians in the diagnosis and treatment of cardiac patients. Many of the program's graduates elect to serve in rural areas across the country. When the center was inaugurated, the Division of Non-Invasive Diagnostic Cardiology was composed of the Heart Station and the Stress Test Laboratory. The Division of Invasive Cardiology, on the other hand, was supervised by the Department of Hemodynamics Cardiovascular Laboratory, performing diagnostic and therapeutic catheterization. In 1976, the Institute had its first anniversary scientific program. In 1979, the Pacemaker Clinic was set up. The center also acquired a two-dimensional cardiovascular ultrasound scanner to see the heart in motion, the first of its kind in Southeast Asia. In 1981, the center inaugurated the Peripheral Vascular Clinic. Its main objective included stroke prevention, limb salvage, aneurysm diagnosis, wound care, and treatment of diseases of the arteries and veins. In 1982, the Department of Diagnostic Cardiology acquired its first two-dimensional echo color Doppler. In 1983, percutaneous transluminal coronary angioplasty was introduced in the Hemodynamics Cardiovascular Laboratory. The electrophysiology section was also opened during this time. It focused on the diagnosis and treatments of complex arrhythmia. In 1984, the Department of Physical Medicine and Rehabilitation was opened. It helped post-surgical patients recover their normal physical functions. It aimed to help patients overcome disabilities or psychosocial problems due to cardiovascular disease. In 1988, the Department of Physical Medicine and Rehabilitation implemented the Comprehensive Cardiac Rehabilitation Program. It was organized to provide the essential components of exercise training and lifestyle modification through group education. In 1989, the center upgraded its equipment with assistance from the Japan International Cooperation Agency. The Cardiovascular Laboratory initiated new invasive techniques, including percutaneous mitral balloon valvotomy, coronary angioplasty, and balloon valvuloplasty. In the 1990s, diagnostic cardiology was further enhanced with new equipment like new units for two-dimensional echoes, transesophageal echoes, and stress echocardiography. The Philippine Heart Center continued to serve an increasing number of both admitted patients and outpatients. In 1994, the former Health Secretary Dr. Juan Flavier led in the launching of Pusong Pinoy at the Philippine Heart Center, ushering in the Bantay Presyon project of blood pressure taking throughout the country for that month. In 1998, the emergency room provided 24-hour service to the public. Fully renovated and expanded in 1998, the emergency room is more than twice its original size. In 1999, the Division of Critical Care Medicine Program was established to provide multidisciplinary specialty dedicated to serve critically ill patients. From 2001 to 2003, the Philippine Heart Center continued to upgrade its facilities. New acquisitions included the latest echocardiography systems, cardiac imaging systems, and cardiac monitors for critical care units. From 2005 to 2009, the center has held 58 People's Day free clinics, which served a total of 4,705 patients. The Philippine Heart Center, a self-reliant institution responsive to the health needs of the Filipino people, is driven by the shared vision of improving the health status of patients, providing comprehensive cardiovascular care enhanced by continuing medical education and research, accessible to all. The Adult Cardiology Department continues to produce highly competent and well-trained cardiologists, not only in the medical field, fostering high-quality healthcare delivery system, but also in the light of clinical research as modern technology advances. Over 45 years, this institution remains steadfast to its commitment in providing compassionate and patient-focused care, paving the way to highest standards of cardiovascular care in the midst of increasing medical and surgical referrals and growing number of patients.